Sukmani Kargil and I'm OET trainer. So today I'm going to discuss about solution to day 7 and let's begin with reading task. First of all, we'll discuss the solution to reading part A. So today you are given the passage on snake bite in South Asia and you are given 4 different texts and 29 questions. To answer these questions, you are having only 15 minutes. So let's discuss about answer to these questions. First answer is worshipped, second is feared, third is Buddhist, and fourth is sacred, fifth is more snake bites, sixth is high population density, seventh is venomous, eighth is males and it must be plural, ninth is females, also it's plural, 10th is 30 or you can write 30 years, 11th is students and 12th is housewives, 13th is time of bite, 14th is daytime or you can write day also, 15th is straight bites, 16th is 60 to 80%, 17th is a grid. You have to write in passive form is a grid. 18th is evaluation. Here you need to change adjective to noun. That is evaluation. 19th is certain India. 20th is delayed or you can write was delayed again in passive form. 21st is very few. 22nd is inappropriate. 23rd is harmful. 24th is too long. 25th is barefoot and 26th is accidentally. 27th is agricultural activities and 28th is rubbish. 29th is firewood. So these all are the answers to the questions of part A. Now let's see how we wrote these answers, where we can find it. So talking about first one, that is worship. You can find it in the text one only, that is background. It is written in the 4th line. However, since ancient times snakes have been worshipped. So this is the first answer. And second is written in the same line, that is and feared in South Asia. So keywords were located and we found the answers worshipped and feared. Next is third question. Third answer is Buddhist. It is written in the same paragraph, just line below this only. That is cobras appear in many tales and just it is written that myths and are regarded as sacred by both Hindus and Buddhists. So answer is Buddhist. Fourth answer is written here in the same line, that is sacred. So this next is fifth question, that is answer is more snake bites. It is written in the first line, very first line, there are more snake bites in South Asia region. So in the first paragraph only we found 5 answers. Next is sixth one, that answer is high population density. It is written in the second line. This is due to its high population density. It's very clear, you just have to pick the same word. Seventh is also here in the same paragraph, third line, numerous venomous snake species. So answer is venomous. Now moving on to the 8th question. 8th question is in text 3. Text 3, it is in the column that is gender. Second column, that is there is a clear preponderance of males among snake bite victims. Answer is males and it is plural. Please take care. 9th is females. It is written in the same point, second line. That is a 2:1 male to 2 females ratio. So answer is females. It is also in the plural form. Next is 10th one. Answer is 30 years. It is written same table in the column age, first line. The mean age of snake bite victim is around 30 years. Answer is 30 years. 11th one. It is written here in occupation. Same text tree, same table under occupation. Farmers account for more than half of the victims. Answer is students. 12th is housewives. It is also written nearby students. Students and housewives. 13 question. 13 questions answer is time of bite. Many students they write incorrect, some of them they write site of bite, but it is very clearly written time of bite. The time of bite depends on the relative abundance of diurnal and nocturnal snakes. It's very clearly mentioned in the same table. Now 14th answer is daytime, or you can write date also. It is written here in the same column. Time of bite. Last line, that is whereas viper and cobra bites mostly occur during daytime. 15th is crate bites. It is written same paragraph, same table, same point, time of bite. Second line, crate bites generally occur at night. Answer is crate bites. Moving on to 16th answer. Answer is 60 to 80%. It is written in the same table, that is characteristics, and under the point site of bite, first line, 60 to 80% of bites occur on foot, ankle or leg. So answer is 60 to 80%. So near about 16 questions we have done and all the answers are straight away. Next answer is 17th. Now 17th answer you will be finding in text 2. It is written, most experts agree that snake bite victims should be transported as quickly as possible to a medical center. Agree. Now you have to change it to passive form according to the grammatical sense of the sentence. So answer would be is agreed. 18th answer is evaluation. It is also, you need to change it to noun from evaluated. It is written in the second line, that is medical center where they can be clinically evaluated by qualified medical staff. It is text 2, second line. You need to change evaluated to evaluation. Next 19th answer is the same paragraph and it's in the 5th line, that is Nepal and studies in southern India confirm. Answer is southern India. Next is 20th. So answer is here in the same line, southern India confirmed that delayed word is written, anti-venom administration was associated. So answer to this was delayed, or you can write is delayed also. Both are correct. Moving on to 21st answer. You will find 21st answer in the similar table, that is in text 3. Table name is characteristics of snake bite victims in South Asia. It is written in the column delay between bite and treatment. It is written in the last line, that is most studies show that at least 60% of victims reach a health center within 6 hours, but very few in less than 1 hour. So answer is very few. 22nd. It is written in the same table under the point first aid methods, second line, inappropriate. Bite victims use inappropriate. So answer to this question is inappropriate and harmful. 23rd question is also written along with inappropriate and harmful first aid methods. So moving on to 24th, answer is written in the same point. Answer is too long. It is written in the 4th line, left on for too long. So moving on to 25th answer, that is in text 4. We will find 25th to 29th answers in text 4. So text 4, and it is in the 4th last line of text 4, 4th line from the bottom. Many bites occur when people walking barefoot. Answer is barefoot. 26 is accidentally, and its answer is same paragraph, 3rd last line, that is 3rd line from the bottom. Barefoot and accidentally step on a snake. So answer is accidentally. 27th is written in the same paragraph, just line below this, accidentally only, that is 2nd line from the bottom. Wearing boots and long trousers during agricultural activities. So answer is agricultural activities. Next is 28th and 29th. It is written in the same line, that is 4th line under control and prevention. That is rubbish and firewood which attract snakes. So answer is rubbish and firewood. So I think all the answers are clear. I think it was too easy. You need not to search any word of your own. Every word was as it is. You just have to change few words like evaluation, agreed. There are 2 or 4 I think are there. I think all the answers are clear. Hope so. Every doubt is clear. And so let's begin with the second part, that is reading part B. You are given the passage on medical staff and night shift, and multiple choice questions are there. There are basically 6 questions you are given today, and let's read the first question. Which of the following is not mentioned a cause of sleep debt? First is regular lack of sleep during the day. Second is staying awake for a long period before the first night shift. C is poor health among health professionals, and D is a build-up of sleep debt during the night shift period. Okay, let's see which is not mentioned a cause. Okay, so answer is C, that is poor health among health professionals. Now why cannot the other 3 answers? First is regular lack of sleep during the day. Actually, I think it's mentioned, it is written that repeated unsatisfactory daytime sleep. So this cannot be the answer because we have to find which is not mentioned. So this has been mentioned, we can cancel it out because we can eliminate the A option. Now, B is staying awake for a long period before the night shift sleep. Oh well, I think it's also mentioned. You can see it is written prolonged prior wakefulness on the first night shift. So this is also mentioned. So we can eliminate the B option also. Now C, poor health among health professionals. If I read it, I don't think so. It's written anywhere. Okay, let's see the D option. A build-up of sleep debt during the night shift period. Okay. Oh well, it is written here cumulative sleep debt after several nights work. So this is same, meaning is same, that is a build-up of sleep debt during the night shift period. So I think this is also mentioned. So we can eliminate this also. We are left with C. So this means C is the correct option. Now second question. Which of the following statement is not mentioned? Again, similar question is there. Lack of sleep among health professionals can affect the safe treatment of patients. B is lack of sleep among health professionals can affect the health of health professionals. C is long hours are very common for trainee medical staff, and D is most health professionals don't get adequate sleep. Now, let's see which is not mentioned. If you read it, I think A is mentioned. You can read it. The net result of this assault on the sleep of health professionals can be impaired patient safety. So here also they are talking about safety of patient. They are saying can affect. Same thing is mentioned. This is mentioned, so we can eliminate A option. Now let's see about the second option. I think it's also mentioned. And the health and safety of health professionals themselves also. So this is also mentioned. Let's see the C option. I think it is also mentioned because it is written here further aggravation, particularly for trainee medical staff and teaching hospital, has been the demand for excessive work hours across the working week. So it is also mentioned here. Now let's read the D option. It is most health professionals don't get adequate sleep. Well, if we see here, I don't think so it's mentioned anything about that, and moreover all the 3 options are mentioned. This means D is the correct option. Now let's see the third question. According to the article, which of the following statement is false? A is people who work the night shift during sleep mode may have increased appetite. B is people who work the night shift during sleep mode may feel exhausted. Okay, people who work the night shift during sleep mode may be unable to keep their mind on the job. And D is people who work the night shift during the sleep mode may respond slowly to certain situations. Let's see which is false. False means you have to find the information which is contradicting to this, any of the options. Means the contradicting information we have to find in this. See, if we read the first option, I think so it's false because it is written about appetite. but they are not saying that the people who work in night shift may have increased appetite. They are talking contradictory to this. If you see the B option, people who work the night shift during sleep mode may feel exhausted. It's true because it is mentioned increased feeling of fatigue and increased sleep propensity. So it is same. C option, people who work the night shift during sleep mode may be unable to keep their mind on the job. I think so it's mentioned because they have talked about impaired concentration. So similar to this, impaired concentration means mind on the job, so this is also correct. So this cannot be the answer. The D option, people who work the night shift during sleep mode may respond slowly to certain situations. Yeah, this is also mentioned because it is written slow reaction. They have mentioned about that. So three options B, C and D are mentioned. This means they are true, but I don't think so. This is true, and so that they have not talked about any increased appetite. They are saying contradictory to this. This means A is false. So A is correct option. Now let's move on to the fourth answer. Which of the following is true? A option, it is beneficial to sleep between 1 to 4 p.m. B is if you sleep in early evening, you will be fully alert at work. C is do not sleep more than 7 hours during the day before your night shift. And D is all of the above. Okay. See? So we have to find which is true. Well, if I read it, you can see between subsequent night shifts, the aim should be to maximize day sleep length by including the afternoon sleeping period 1 to 4 p.m. So this is correct. So answer is A. Now let's move on to the fifth question. Recent studies have shown that long 2-hour naps are more beneficial at night. Okay. B is short naps are equally effective at night as they are during the day. Okay. C is short daytime naps are less beneficial than longer daytime naps. And D is none of the above. First is long 2-hour naps are more beneficial at night. But I don't think so. They have made any comparison, but they are talking about of equal benefit. This means this cannot be the answer. B is the correct option. Short naps are equally effective at night as they are during the day. Because they have talked here, therefore the picture emerging from night shift napping studies is similar to that from afternoon studies. So B is correct option. Question number 6. Overall, the purpose of the article is to explain that A option is health professionals don't get enough sleep. B is both short and long naps during night shift will improve work performance and patient treatment. C is during short nap during night shift may be the best way to improve work performance and patient treatment. D is tired health professionals are less efficient than alert health professionals. Read the line that is written in the end that is optimal benefit and a higher take up rate are likely for sleep lengths of 10 to 15 minutes. So this is similar to C option, that is short nap during night shift may be the best way to improve work performance and patient treatment. So C is the correct option. So I think all the 6 questions are clear to you. I have discussed all the options and all the answers to all 6 questions. Now let's move on to the next passage. That is about arthritis. So it is having 10 questions. Let's see about the first question. So first is, which of the following statement is correct? Answer is B. B as in beta. That is more adults in US have arthritis than in Australia. Why this is correct option? Because in paragraph 2 it is written United States of America reported 21.6% of adults have self-reported doctor diagnosed arthritis. In Australia it is estimated that 2020 1 in every 5 Australians will have arthritis. 1 in every 5 means 20%, because see, whenever you have to calculate percentage from 1 in 5, how you have to just calculate, I will tell you. You just have to write 1 in 5 means 1 in 5 into 100, so it is 20%. You may get these types of questions in part A also. So 1 in 5 means 20%, and in case of US it's 21.6. So US is having more, so that is why answer is B. Now let's move on to the second question. According to the article, a cure for arthritis is, answer is C, that is hard to find. Why? Because it is written here in paragraph 2 only, a cure for arthritis has proved elusive. What do you mean by elusive? Elusive means hard to find. So elusive we can say synonym to hard to find. So that is why answer is B. Sorry, answer is C. Okay, now third question. Which of the following statements is not reflected in the article? Answer to this is B. Some powerful drugs can provide a permanent cure. So which is not reflected means which is not mentioned. It is written some powerful drugs can provide a permanent cure. See, in paragraph 3, read the line, powerful non-steroidal anti-inflammatory drugs and corticosteroids, such drugs can provide effective relief from the pain, joint stiffness and inflammation, but do not result in a permanent cure. So this means they do not provide permanent cure, but here they are saying they can provide. This means B is the correct option. Question number 4. Which of the following statement is correct? Answer to this question is C option, that is hip replacement surgery usually improves mobility. Now read the paragraph 4. You can read, such procedures can be highly effective in enhancing mobility in the majority of cases. So that is why the answer is C. Now fourth one is C. Let's do the fifth question. According to the article, which of the following statement is false? Answer is A, that is glucosamine dietary supplement is clinically proven. But we can read in paragraph 5 and paragraph 6. If we read it, it is written not proven yet. So this means answer is A, because they are saying contradictory to this. Sixth question. In paragraph 8, the expression anecdotal evidence can be best described as. So answer to this is A. Why? Because it is written there is also anecdotal evidence from people with arthritis. So that is why it's A, that is a personal observation. People, so they are talking about personal observation of people only. So that is why answer is A. Let's move to the seventh question. Which of the following statements appear in the article relating to diet? Answer to this is C, that is arthritis sufferers indicate that some foods adversely affect their condition. In this question I would like to tell you would be confused between C or D, because most of my students they opt for D option. Why? Because they got that line, they get that line in the first only, that is first line only, that is fatty fish such as herring, tuna and mackerel and swordfish must be eaten twice. So swordfish, there they have talked about semolina. So that is why it cannot be the answer. Answer is C, because it is mentioned here in paragraph 8 only. There is also anecdotal evidence from people with arthritis that certain food impact negatively on their condition. So that is why answer is C and not D. Moving on to question number 8. In which paragraph can you find a description, a style of Tai-Chi which is useful for sufferers of arthritis? So it is very clearly mentioned in paragraph 11. You can read that paragraph 11. They have talked about all the movements, fluid and gentle and slow and help reduce, means they have talked about the style of Tai-Chi here. So answer is C. Ninth question. Which of the following is correct from the article's point of view? And its correct answer is D. That is, for optimum results, a close relationship between you and medical professionals is essential. Why the D? Because it is mentioned in paragraph 13. The line is, the best outcome require a close partnership between you, your doctor, and any health professionals or practitioners involved in your treatment. So answer is D. 10th question. 10th question says the article makes the following suggestions. So what are the suggestions mentioned in the article? And answer to this is B as in butterfly. So how you can say it's B? Because it is written here in paragraph 15. That is, living with arthritis does not mean you cannot have an enjoyable and fulfilling life. So, answer is B. So, I think I have discussed all the 10 questions of paragraph B also. So, just go through these solutions and just evaluate yourself how many questions you get correct. So, now we are going to discuss about writing module. So, in writing module, you were given a letter. And name of the patient is Maria Joseph. First of all, we need to read the writing task. Using the information given above, write a letter to neurologist who will attend the patient in the emergency department. So we are going to write letter to neurologist who is going to just attend this patient in emergency department. Let's read the case history. Patient name is, as I told you, it's Maria Joseph. She is 39 years old woman who has been a patient at a hospital. You are working in as head nurse. This means your designation is head nurse. Apart from usual childhood illness such as chickenpox, she had been healthy. Okay. Then if we read it, her review on 10th of May 2011. Subjective was frontal headache. Subjective means the patient states according to the patient, and objective means which you observe. So frontal headache for 6 hours, mild associated suffering from nausea, no vomiting, patient with blurred vision but not aura. No other symptoms noticed. She has no family history of migraine. Okay, objective is, on that similar day only, you noted her pulse that was 96, BP was 130/70 and normal cervical spine movement, examination was normal. Assessment, probably due to excess tension or personal dilemma. Plan is, means what you planned on that day. That is, advised to take rest, given analgesia, that is paracetamol, and again she presented on 14th of same month. She complained of continuous headache, left-sided and frontal, blurred vision, throbbing headache, that is left-sided, vomited 5 times during last 3 hours, complaining of slight paresthesia also. Objective was, you just observed that patient was distressed and pulse noted as 103 and BP is 150/90, normal peripheral nervous system. Assessment is severe migraine possibility, means you suspected that it's severe migraine, and plan was stat, pethidine and intramuscular injection moxilone. Again, next day she again presented. Well, it's you visited. It's it's a home visit, and subjective was because she fell down at home due to severe left-sided headache, injured her right arm, bruises on her left leg, slurred speech and half unconscious. So this is what you just when you went for home visit, she stated that, or her relative, whatever. The objective was patient's pulse was 100 and BP was 150/90, extension 4:5 power and left leg knee flexion. Assessment was, what you assessed is probable intracranial pathology and space occupying lesions. Plan is urgent assessment in emergency department. So during home visit only, you plan to refer her to emergency department. So that is why you are writing it to the neurologist. Now whenever you get different dates or different reviews of the patient, first the trick is read the last one, the latest one, that is on 15th of May. That you need to mention in introduction. Means I am referring the above mentioned patient with probable intracranial pathology and space occupying lesion. So this you have to mention, and next you have to mention about the first review, that initially she presented with frontal headache for 6 hours. You can write she presented on 10th of May with these conditions, and these were noted. And then you can write again after, in her second review, after 4 days, she was this and this. It was observed severe assessment, or we can say that she was distressed, or you can write about normal peripheral nervous system also. After mentioning all the reviews, you have to say that today she presented, today I visited home, or we can say during home visit, she stated that she fell down at home due to this. You have to mention everything, and her BP noted. Here her BP was this, and this was left knee flexion. You have to mention. Then you can say, so I suspect it's this problem. So I am just urgent. Your urgent assistance, or we can write urgent assessment in this case would be appreciated. How you have? This is how you have to write it. So I don't think so. No, she's having no medical history. You can write her general health is fine. She has no significant medical history. You can write this also. This is all about the patient you need to mention. And this is how you have to attend this letter. So your word limit should be 180 to 200 words, not more than that. You can write 190 to 185. That's enough. So you have to write in 40 minutes. 5 minutes to read the case notes and 40 minutes to attend the letter. So let's move on to the next module, that is speaking module. So in today's speaking module, the topic is on skin problem. You are the head nurse at Mau Skin Care Clinic. The patient has come for a skin problem. It is noted to be rosacea. Okay, the patient is very nervous to know this. Doctor at the clinic has sent him to you for further instruction to be received from you. So she or he has already visited doctor, and doctor has sent the patient to you regarding the discussion or discussing about the problem and everything. Your task is you have to explain it to him or her that this is really no treatment, there is no treatment for this problem, but it can be easily be controlled. Explain to him that when to apply the face cream or how it can reduce the redness and make him look normal. Here you can just ask like, you can say doctor sent you to me for further discussion. Am I right? You can say like this, and then you can ask for, can I have the prescription from the doctor that you got? Then you can see that doctor has prescribed any face cream and tablet. Then you have to tell about you can ask about, do you know how to apply the face cream? Then you have to just suggest him or her that just wash your face properly, clean your hands, apply gently, do not go to the sun after applying it. You just have to mention this. Explain this too, that there will be no side effect of face cream. Advise him or her to bring some changes in life, in diet as well. So you can ask about, is it for the first time? You can ask this also, and you can ask about the dietary habits, and even sedentary lifestyle like smoking and alcohol and caffeine, intake of caffeine, or you can ask about the intake of fluids also, water. Advise him or her to bring some changes, and then advise him or her not to go out without applying sunscreen lotion. Then you can ask about the profession, is he or she student or working, and you can ask, do you go out in the sun, and whenever you have to go, never go without applying sunscreen and always cover your face, and you can tell, do not apply such local cosmetics, and moreover you can just also tell about the dietary habits, as well as you can also tell about, you can ask, have you made any changes in your cosmetics, have you changed your perfumes and all. You just have to ask this. Why I am saying this? Because it is not mentioned, but it's very obvious. If we are having skin problem, diet need to be asked. There should be the changes need to be made in diet also, lifestyle also. Like if he or she is smoking or having excess intake of alcohol, it affects our diet, our skin also. You can ask this also. So you just have to handle the patient, you have to tell about the medicine, you have to tell you need to make some changes and follow the instruction, and about the applying of face cream also. and it's a clinic. Please, you don't have to tell that how are you or like that. You can say, hi, I'm the head nurse over this clinic. So how may I help you? Or you can ask the name of the patient, then you can ask your prescription, and then you have to explain it everything. So I hope this all is clear to you. So you'll follow all my instructions also. And thank you. Let's begin with the listening task. I'll be telling you something about listening. Now I'm going to give you a brief introduction about listening modules for today. And in part A, you are getting a consultation between doctor and a patient. And doctor is interviewing Alfred Jenkins, who is a patient and who has recently suffered a heart attack and has been just transferred from an intensive care ward. So doctor is on the staff for general ward of the hospital, and this is the first consultation with the patient. So you'll hear the interview once only. Please keep in mind, and as you listen, you must make notes about consultation under headings given to you, and you just have to write in brief. Don't write full sentences, make notes. And second part, in part B, you'll hear a lecture, and it is on Tourette syndrome, and in this recording, you'll hear a talk on Tourette syndrome, and you just have to play this talk once so that you can have good practice and answer the question in the space provided. And there will be some pauses also, and use of synonyms are there. You can use, it is acceptable, abbreviations are acceptable, and please make notes. So here in Tourette syndrome, the first question is what age group is there. You need to write the age group, then causes, then you need to complete the table, factors which intensify the symptoms and factors which lessen the symptoms. Then again, its table is there, tics and vocalizations are there, then which of the following statement is most correct, and here you need to write the most appropriate, the most closest to correct. Then there are you just have to write completing the notes, and only 3 of them you have to mention. Maybe he will be talking about more than 3, 5 to 6, so you have to write only 3. So this was all about day 7 today. So in the next video, I'll be there with the discussions of day 8 module. So till then, take care, see you, and bye-bye.